Has your once lively son become withdrawn and quiet? Have you noticed that he spends more time alone in his room, avoiding family activities and social gatherings that he once enjoyed? These changes can be subtle at first, but over time they may become more pronounced and worrisome. Are you noticing changes in his behavior that leave you feeling concerned? Perhaps he seems more irritable or easily frustrated, or maybe he's lost interest in hobbies and activities that used to bring him joy. These behavioral shifts can be confusing and alarming for any parent. Adolescence is a time of significant change, often marked by emotional ups and downs. It's a period where teenagers are trying to find their identity, which can lead to mood swings and unpredictable behavior. While some of this is normal, it's important to pay attention to the intensity and duration of these changes. However, it's crucial to differentiate between typical teenage angst and signs of a more serious issue: depression. Depression is more than just feeling sad or going through a rough patch. It's a persistent feeling of sadness and loss of interest that can affect how your son thinks, feels, and behaves. Depression in boys can manifest differently than in girls, often masked by anger, irritability, or risky behaviors. Instead of appearing sad, a teenage boy might seem more aggressive or prone to outbursts. He might engage in risky activities such as reckless driving or substance abuse as a way to cope with his feelings. It's essential for parents to be aware of the warning signs and understand that seeking help is a sign of strength, not weakness. Consulting a mental health professional can provide valuable insights and strategies to support your son. Therapy can offer a safe space for him to express his feelings and learn coping mechanisms. Remember, you are not alone, and there is hope for a brighter future. Many families have navigated these challenging times and emerged stronger. With the right support and intervention, your son can overcome these difficulties and thrive. Stay connected, keep the lines of communication open, and don't hesitate to seek professional help when needed. Early identification of depression is vital for effective treatment. Boys may exhibit depression through various behavioral changes. Withdrawal from friends, family, and activities they once enjoyed is a significant red flag. Changes in sleep patterns, such as insomnia or excessive sleeping, are common indicators of depression. Increased irritability, anger outbursts, and difficulty concentrating can also signal a problem. Pay attention to any expressions of hopelessness, worthlessness, or a loss of interest in the future. These signs should not be ignored. If you observe persistent changes in your son's behavior that raise concerns about depression, such as prolonged sadness, withdrawal from activities they once enjoyed, or noticeable changes in their eating and sleeping patterns, it's important to take these signs seriously. These changes can be subtle at first but may become more pronounced over time. It's crucial to seek professional help when these behaviors persist for more than a few weeks, or if they start to interfere with your child's daily life. A mental health professional can offer the support and guidance needed to navigate these challenging times. Don't hesitate to reach out to your child's pediatrician or a mental health professional. They can provide initial assessments and refer you to specialists if necessary. Early intervention can make a significant difference in your child's recovery and overall well-being. Early intervention is key to successful treatment. The sooner your child receives help, the better the chances of managing their symptoms effectively. Therapy, counseling, and sometimes medication can be part of a comprehensive treatment plan tailored to your child's needs. A qualified professional can conduct a thorough evaluation, provide an accurate diagnosis, and recommend the most appropriate course of action. This might include individual therapy, family therapy, or other therapeutic interventions designed to support your child and your family. Remember, seeking help is a sign of strength and a testament to your love and concern for your child's well-being. By taking this step, you are showing your child that they are not alone, and that their mental health is a priority. Your support can make a world of difference in their journey towards healing and resilience. Section 4. Supporting your son, a parent's guide. Navigating your son's depression journey requires patience, understanding, and unwavering support. Create a safe and non-judgmental space for him to share his feelings, even if he doesn't initially open up. Encourage open communication by asking open-ended questions and actively listening without interruption or judgment. Let your son know that you are there for him, no matter what. Small gestures of love and support can make a world of difference. Section 5. Encouraging open communication. Creating a safe and supportive environment is essential for encouraging your son to open up about his feelings. This means being available and approachable, so he knows he can come to you without fear of judgment or criticism. It's important to show genuine interest in his life and experiences, which helps build trust and openness. Choose a time when you can both relax and talk without distractions. This could be during a walk in the park, a quiet moment at home, or even while doing a shared activity. The key is to find a setting where both of you feel comfortable and free from interruptions. Avoid interrupting or offering unsolicited advice. When your son is speaking, give him your full attention. This shows that you respect his thoughts and feelings, and it encourages him to share more openly. Sometimes just being heard is all he needs. Instead, focus on active listening and validating his emotions. This means acknowledging his feelings and letting him know that it's okay to feel the way he does. Use phrases like, "I understand," or "that sounds really tough," to show empathy and support. Let him know that you hear him, you understand, and you are there for him. Physical gestures like a reassuring touch or a comforting hug can also convey your support and understanding. These small acts of kindness can make a big difference in how he feels. Be patient and understanding, as it may take time for him to feel comfortable sharing his struggles. Building open communication is a gradual process, and it's important to give him the space and time he needs. Your consistent support and patience will help him feel more secure in opening up to you. Section 6. Hope for the future. Recovery is possible. Remember, depression is treatable, and recovery is possible. With the right support, your son can overcome this challenging period and live a full and meaningful life. Treatment may involve a combination of therapy, medication, and lifestyle changes. It's essential to follow the guidance of healthcare professionals and be patient with the process. Celebrate small victories along the way, and never lose sight of the hope for a brighter tomorrow. Section 7. Resources and support. Navigating your son's depression can feel overwhelming, but remember, you are not alone. Numerous resources are available to provide support and guidance. The National Alliance on Mental Illness, or NAMI, offers support groups, educational programs, and online resources for families affected by mental health conditions. The JED Foundation focuses on protecting emotional health and preventing suicide among teens and young adults. Don't hesitate to reach out for help and support when you need it most.